Welcome to Doctors on Call. I'm Jenna Miller. For as long as we can remember, parents have told their rowdy kids to go out and play. In doing so, most hadn't a clue they were nurturing the emotional, cognitive, language, and self-regulation skills that build executive function and social aptitude in children, all while enhancing critical brain structures that support pursuing goals and ignoring distractions. In other words, play is needed for healthy development. Your heart, your brain, your entire body benefits from exercise. Fitness means being able to perform physical activity. It also means having the energy and strength to feel as good as possible. Getting more fit, even a little bit, can improve your health. Family and sports medicine, that's our topic today on Doctors on Call with our guest, Dr. Thomas Dagg.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Camco, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.
Thomas Dagg, MD, specializes in family medicine and sports medicine. He particularly enjoys working with patients of all ages, from babies to grandparents. His patient care philosophy is one patient at a time, as he likes to get to know the person behind the patient. Dr. Dagg chose to add sports medicine training to work with patients who have pain or injuries that keep them from activities they enjoy. Dr. Dagg earned his medical degree at Paul L. Foster School of Medicine at Texas Tech and completed his sports medicine fellowship at Ascension Via Christi in Wichita. He earned his bachelor's degree in biomedical science at Texas A&M University. Dr. Dagg now serves as a family medicine and sports medicine physician at the University of Kansas Health Systems in Great Bend. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us tonight. Let's go ahead and get started with some of our questions.
Yeah, thanks for having me.
Absolutely. Let's say a patient or a person has not been exercising and they want to start something. Do they, you'll see that, the disclaimers of check with your doctor first.
Yeah.
Does a person really need to do that?
So it kind of depends on your fitness level going into that activity and what the activity is. If you're someone that has lots of medical conditions, there's a few different medical conditions that would kind of preclude you from physical activity. So moderate to severe COPD would be an example. Some heart conditions would make it so it'd be a bad idea to exercise. Generally, if you were fit and young, that's not something that you necessarily need to see a doctor for. But again, if you're exercising and you start to have shortness of breath or chest pain, or it's a good idea to stop and see someone before you kind of go on from that. So
now, sometimes a person will start an exercise program and they might gain weight rather than lose. Why is that?
So a lot of times when people start to exercise, they might not even notice, but they kind of will allow themselves to cheat sometimes as far as eating goes. So a lot of times I say nutrition is actually more important than exercise. And I try to get people to buy into just being healthy and not always focusing on weight loss as like a number, but just thinking about your body as a whole and the different processes that are going on, and just getting all of those things to be more healthy. So exercise is a big part of that, but I would say a lot of times nutrition's bigger. And so when people start exercising, maybe they cheat, they're not necessarily keeping track as thoroughly with their calories, and so frequently that's the cause of that.
And how do you hear about that? Counting calories is so important. How does a person do that?
So I like MyFitnessPal. There's other apps out there. There's a Weight Watchers app, and I used to not like Weight Watchers as much. I didn't really believe in their philosophy, but I think that they've kind of changed things around, and they focus on the types of food. So that's just as important as to me as the total calories that you're getting is eating nutritious food. If you look at a plate full of broccoli is as many calories as half a Snicker bar, you know. It's really important to try to get back to as natural as possible. But for daily counting calories, I think apps are super helpful for that. So.
And is it possible, if a person wants to lose weight, if that's their goal, is it possible to lose weight by just changing your diet and not exercising?
100%. Yeah, that's definitely possible. I see that pretty frequently, actually. And that's especially more helpful for patients that are older that maybe can't, because there's different guidelines on exercise. There's guidelines on moderate exercise or vigorous exercise, kind of based on what someone's ability is. Some of the older patients that have these comorbidities, they can change their diet, lose weight, get healthier, all those things just from diet alone.
Interesting. Let's talk about some non-operative approaches or treatments to sports medicine.
Yeah, so there's a couple different avenues to get to sports medicine. I went through family medicine residency and then sports medicine. There's also the orthopedic side. So we work pretty closely with the orthopedic surgeons, and a lot of things that used to be operated on aren't operated on as much now. So like tennis elbow, for example, is something that I see pretty frequently and I get referrals for, and I'll kind of work it up, make sure that it's not something else, talk about different medications to take, different bracing, and then I can actually do ultrasound guided procedures on that lateral epicondyle before surgery, and it's something that rarely needs surgery nowadays. So that's one example.
Very good. Now, you mentioned tennis elbow. What are some of the other common overuse injuries that you see a lot?
Yeah, so it kind of depends on the age group. So for older patients, tennis elbow is pretty common, golfer's elbow, a lot of hip overuse injuries, so especially like lateral hip pain with the greater trochanter bursa. A lot of that stems from pickleball, side-to-side movements, can kind of inflame that. Younger patients, it's going to be when kids are in high school and they hit a growth velocity. A lot of times their patellar tendon gets inflamed because their bones are growing faster than their tendons can grow and their muscles can grow. So that it's just not used to being stretched. And so whenever you load that tendon, that's pretty common that kids can get that. And then there's plantar fasciitis. That's something that older people get, and also it's pretty common in marathon runners because it's an overuse injury in marathon runners. And then a lot of times it's a dysfunction of a couple of the muscles in the calf in older patients. So yeah, those are just some of the stuff that we see. So.
Okay, well, we're going to go to the phone lines. We've got Diana on the line from Salina. Hi, Diana. Go ahead with your question for Dr. Dagg tonight.
Hi, thanks for having me on. My question is, about 10 years ago, I tore my ACL and MCL in a basketball game, and I'd never had surgery on it, and just kind of rehabbed on my own. My ortho surgeon at the time just said if I wasn't going to be in extreme sports, I probably didn't need it fixed immediately. But now that I'm in my 40s, I still feel fine, but is that something later on that I'm going to have problems with? Like, should I go back in and have surgery on that?
Yeah, that's a super good question. You know, that's kind of tricky. So with ACL tears, it's just devastating. It's a devastating injury. A lot of times, even if they went back in and fixed it, if you look at the data, there's still similar replacement outcomes. So basically, it's something that you'll probably need a joint replacement for in the future. there's just a lot of rotational force that the ACL stabilizes in the knee. And so whenever you don't have that stabilization, there's more wear and tear on that joint. And it's at this point, I think that I probably would hesitate to go back and have that surgically corrected, especially if you're not having pain. I would just kind of continue on the pathway that you're on right now. And I don't think that repairing that is going to decrease the likelihood that you'll have to have a replacement in the future. So.
Excellent. And she mentioned, that ACL, MCL tear. You hear of the kids, blowing their knees out all the time. How do they prevent that from happening?
Yeah, so there's some data right now that shows there's something called the FIFA rules, and it's about a 20-minute exercise regimen that focuses on strengthening in the hips and developing proprioception, which is basically just neuroconnections from your brain to your muscles, so that whenever you're in a game situation, that you don't put your body in a position where you're at higher risk of tearing your ACL. So it's something that I think would be a good idea to be added, especially high school basketball girls, high school soccer girls that have a very high risk of tearing their ACL. Something that could be really helpful in those populations, and it's something that is kind of being implemented, especially in soccer. So.
And Diana had mentioned that she just kind of rehabbed on her own. When is it okay to treat, yourself, even if it just is with ice, heat, that type of thing? Yeah,
so it kind of depends on the injury. Ice is best after an acute injury, typically, so it'll decrease how dilated the blood vessels are. That's where the swelling comes from. It's just all the blood rushing to that area. That's just kind of the body's natural response. So ice is a really good idea for that. For someone that has, degenerative knee pain or back pain, then heat is a better option, especially if they're stiff. As far as treating yourself, I think there is some good resources out there and online, but if you're not getting better and it's been a week or more, I think a lot of times it's a good idea just to have a second set of eyes take a look at it and see if something else could be done.
Sure. And when is a wrap or brace recommended?
Yeah, so braces and wraps. So wraps, again, for like swelling. Braces are typically used for specific issues that are going on. So for instance, if someone has a lateral ankle sprain, it's recommended after they rehab, when they go back to sports, at least for the first 6 months, to wear a lace-up ankle brace. It's been shown, and it should be a lace-up. There's other ankle braces that you can't lace up, and the studies weren't done on those. So other things like MCL or a LCL type injury, you can wear a functional brace with that, which can help with the recovery. But then afterwards, you can also wear it in sport just for that extra support. You see a lot of football players with those. So
now, we were talking about the nutrition side. Now we're kind of focused on exercise. You hear you should go back and forth between strength and aerobic, that type of thing. How do you feel about what type of exercise a person should do?
Yeah, so I think it's important to get a balance. The American Heart Association gives out guidelines, and their most recent guidelines, and it's kind of, we touched on it a little bit earlier, with, should someone see a doctor before they start exercising. The guidelines right now is 150 minutes a week of moderate exercise. So that's 50 to 70% of your heart rate max. You can calculate that 220 minus your age. So that's kind of how you can calculate that. And so that's your goal heart rate, or 75 minutes of vigorous, which would be 70 to 85% of your heart rate max. So that's recommended 5 days or I guess we usually divide it out 5 days a week is what I say, 30 minutes a day of moderate exercise. I think that it's pretty important that people also focus on strength training though. And that's going to be something that helps people have less pain a lot of times going forward. If they can support a joint in its optimum position, then that's going to make them feel better. And it's actually recommended that 2 days a week, some people do yoga, or not yoga, but flexibility. And I usually say yoga because that can kind of knock out a lot of times the strength and the flexibility portions of it. So it's important.
Sure, absolutely. And what are some low impact exercises that have really great benefits?
Swimming is one of the bigger ones, elliptical. Sometimes people have ellipticals in their house. They don't even have to go anywhere for that. Those are usually the first kind of go-to. It's important to find something that you enjoy too. Because a lot of people try to force themselves to exercise, and I think that can be okay for a short period of time because sometimes they start to notice that they really enjoy it. But really finding something that you want to wake up and do can be really helpful. So.
Sure. And is there a better time of day? Sometimes you'll hear that if you exercise first thing in the morning, that's best for your metabolism. Any truth to that?
So that's kind of an interesting question. There was a study done recently that says actually exercising later in the day is better. That was for specific populations. So specifically like an older population, there's a lower risk of having heart issues, especially heart attack. I personally like to get it out of the way, so I like to wake up and exercise. But yeah, so I think if you're older, it might be a good idea to just kind of let your body adjust to everything. But if you're young and healthy, I think it's whenever you have kind of the best opportunity.
And speaking of best opportunity, right before bed, is that a terrible time to exercise? I've heard it can help with sleep. What's your opinion?
I think that right before bed is probably not the best time. Usually I say 2 hours before bed, you shouldn't be exercising. It can kind of actually wake you up and make it harder to sleep sometimes. Yeah.
And what about arthritis? Can exercise help aid in that?
Yeah, so that's also a really good question. It can help prevent it. So a lot of people think, oh, runners, I don't want to run because then I have an increased risk of having a knee replacement in the future. And actually, runners compared to the general population have a lower incidence of knee replacement. But there's a caveat. If you already have pretty significant arthritis, it can make it worse. So.
And why is it important to strengthen your core?
So the core is kind of like the foundation of everything. So if you have a weak core,
and we might talk first about what is your core.
So it's basically just the muscles that are around the center of the body. So it'd be things that you exercise, like abdominal muscles, and then especially the upper legs, your hips, all those can kind of be considered core muscles. So it's important to have a strong core, especially in athletes that are trying to compete at a higher level, because it's going to allow you to do the motions in the sport that you need to do. And it can also kind of help offload the other joints and everything whenever you have a strong core. So.
And what type of exercises are a good core exercise?
So it would be like deadlifts, squats, and then abs. So it's basically like abs, back exercises, and then upper legs are going to be the exercises that would be good for core.
Sure. And how about balance exercises? Are those what can a person do to help with their balance, or what can you suggest as far as that goes?
Yeah. So It kind of depends on your activity level. People can even start by just standing on one leg for a period of time. And then you can progress to, there's all sorts of different poses as far as yoga goes. But a lot of the things that you would do in yoga help with balance. And it's basically just holding your body in position for a period of time. And yeah, I would look up like different flows and stuff if you're young and active, or even walking can help. Physical therapy has been shown to decrease falls in older adults. And so going to physical therapy, they're going to do like gentle bike can help. And then some of the leg lifts and stuff like that can help your balance too.
Okay. We're going to go back to the phone lines now. We've got Dominique on the line from Halstead. Hi, Dominique. Go ahead with your question for our guest tonight, Dr. Dagg.
Hello. My question is, why are girls more prone to ACL tears?
Yeah, so that's a really good question. Girls are more prone to ACL tears because of typically having wider hips and the legs kind of taper down. We call it a Q angle, and it's measured from your hip to the inner part of your knee. And so if you think about landing from a jump, your knee is naturally gonna move to the inside and kind of cave in. And so the FIFA rules is focused, those exercises are focused on increasing your hip abductor strength so that it pulls your leg outwards. And so when you land, your knee doesn't cave in as much. So that's a big factor. Girls typically have smaller ACLs than men or boys. And they also have estrogen, which doesn't make the tendons and ligaments quite as strong. It increases the laxity of, I shouldn't say it doesn't make them as strong, it increases the laxity of those tendons and ligaments. So those are typically the reasons that girls have higher ACL tears than boys in sports.
Very interesting. How does a person go about finding a good gym or workout center, or can they get a good workout just being at home?
Yeah, so you can definitely get a good workout at home. There's there's a few different apps, like the Nike app has certain body weight exercises that can be done at home. As far as the gym goes, I think a lot of times if you're not comfortable, if it's not something you've done before, it might be a good idea to even have a personal trainer just kind of walk you through stuff, even if it's just for, 2 weeks or a month, just getting some foundational lifts down. And then I think, I think that people would be a lot more comfortable going and working out if that was the case. I know the first time that I walked in the gym, I wasn't very comfortable, so.
Sure, not everybo's cup of tea.
Yeah.
Let's talk about vitamin D and how important that is.
Yeah, so the studies on vitamin D are kind of mixed. So basically, almost everybody's deficient in vitamin D. It's a vitamin that we get from our diet, but we also get it from the sun and through a chemical reaction in our skin. So it has been shown to be important in chronic disease, so like chronic kidney disease. It's important because it helps with the calcium metabolism. And so if your calcium's out of whack, your bones can break down. And so that's kind of the idea of vitamin D, is it helps to build up our bones. I think that it's probably most important in chronic disease, but in elite athletes, there was some performance studies that showed maybe it makes a little bit of a difference. So that's something that you can definitely get checked and get treated if it's low. So.
And can you get vitamin D even on a cloudy day?
Yes, you can. So actually, a lot of times on cloudy days, UVA is blocked, like one of the UV light waves, but UVB still is full strength. So you can still get burned, you can still get the vitamin D. So a lot of times people will go outside and think that they're totally fine on a cloudy day, and then they come in with a sunburn. And so it's always important to remember to put on sunscreen during those days too.
Awesome. Okay, well, we talked about some really great things tonight. Thank you, Dr. Dagg, for being our guest on Doctors on Call. You can always email us questions for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from GAMGO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital. Experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.